I thank very much the opportunity of IFA to join with SIOG today in an effort for a call to action well beyond the experts in this field. The call to action must go to our members, those that represent over 75 million people in the world today, aged 60 and over. You know, to the governments, to the non-governments, to academia, and also to older people.
We strongly believe that every oncologist and every healthcare worker in oncology should become a geriatric oncologist and healthcare worker. We all are seeing these patients. We don't need specialists for this. Every oncologist needs to be aware of the principles of cancer in older individuals.
As SIOG is a society of experts in the field of geriatric oncology, we thought it was our duty to think through what the priorities should be to advance the care of these patients.
We sponsor the top priorities through clinical practice, and again, showing how we can develop geriatric oncology clinics, both in the academic center, but both by partnering with researchers and clinicians in the developing worlds, and also in the community.
So what are the conclusions after 20 years of SIOG? First of all, the incidence and prevalent cancer in older people is increasing worldwide. So for that we have no question about that. Cancer is cause of death and disability in older individuals.
The impact of cancer on Australia's ageing population is a compelling rationale for a focused, coordinated national approach on cancer control for older Australians. In light of this, our vision is to shape a health system which is more responsive to the needs of older people with cancer.
We are also part of something called the Madrid International Plan of Action on Aging and the San Jose Charter on the Needs of Older People in Latin America and the Caribbean. And there was a review done recently, and it addressed the whole area of equitable access to comprehensive services. And you would see their creation of degree programs in geriatric and gerontological services, and policies to address non-communicable diseases.
Cancer constitutes a high cost to individuals, households, and to countries with staggering economic burden. Preparing for an aging population is integral to the achievement of many of the SDG goals.
Multidisciplinary teamwork, which is essential in every type of healthcare, oncology being a very nice example.
The other thing is we're experiencing is that cancer pathways and experiences for the elderly today are actually quite poorly understood. It's absolutely fascinating. What we've done and others looking at what's going on is we talk about post-Westphalian public policy. What we mean by that is standard healthcare policy is usually, as Philip mentioned, a matter of individual nation states. But cancer patients are moving across borders and regions now to access care. Vast numbers of Afghan elderly moving to access care in Pakistan, for example. These are sorts of transitions we've never seen before and really alter public policy, both in terms of political economy and from a political point of view.
And all this requires a strong collaboration at an international level to get prepared. Economically, we've seen that, socially, technologically and institutionally as well. And that requires this network of international collaboration.